Yes.
Ron, you've had the opportunity to speak with some international authorities on the topic. What do you get from others that you talk to when you maybe propose that the conventional diagnosing and treatment for this is really without order and confusing, and I guess not consistent between clinicians? Do you get a common answer that yes, they acknowledge that's the case, or they disagree with you?
Some acknowledge it, but most of them are too wound up in their own world.
Mm.
They have their own ideas, their own belief systems, and it's hard to shake those.
Mm-hmm.
And so, and they all have their method of treatment. So the surgeons have their scalpels, and internists and so primary care have their anti-inflammatories and their physical therapy, and they're all pretty comfortable with their paradigm of care. And if people aren't recovering, they get passed on to the specialists fairly quickly, and the specialists do their thing. And it's not unusual for them to toss the patient back to the family doc and say, we've done what we could. You'll have to pick up the ball. And the family docs are tired of that. And so the family docs are very, very familiar with the fact that they are not well trained, that they don't know who to believe and who to go to, because they get pitched from everybody about sending their patients to the therapist, the chiropractor, whatever. And so the real problem is we don't have a standardized way of evaluating these people to make a diagnosis, or at least to categorize them in some meaningful way that will identify a predictably effective treatment. And so the real issue is the diagnostic side.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.